graduating high school, I had an idea that I wanted to start pursuing my education at college level in the nursing program. So I had options, and I was interested in choosing Vanier as the college where I'd be pursuing my studies. One, because it had an amazing campus, it was beautiful, the location was great, and I really liked the setup of the program and the resources that were available. Nursing is a really rewarding program. You're surrounded by amazing people. You get to learn firsthand, and you get to learn about communicating with others. You get to learn about a lot of different skills and how to care for people. But with that comes a lot of different challenges that you don't necessarily expect. There's a lot of responsibility. You get to care for others, and you have to make sure that you manage your time wisely. I guess when you start nursing, you have an idea of what it's going to be like, and you have an idea where you would fit in that profession. But then as you are exposed to different kinds of families, different people, different settings in the hospital, that comes with different challenges, whether it be learning to stand up for yourself or stand up for others. That's why you're a nurse. You're advocating for your patients.
I've grown a lot. I've met amazing friends that are still they're becoming my colleagues, and the teachers, we have a very good bond, and I hope it will stay like that for many years.
We're one of 2 out of 7 students who came back from Malawi as part of the nursing exchange here at Vanier. I'm the type of person who likes to help other people, so the nursing program, nursing profession itself, is all about helping others when they need it the most. I think the biggest challenge is adapting to a new culture, but the trip itself was a lifetime experience because it puts things into perspective. You know, we can say we're starving. You really understand that concept when you're in a different country.
Yes, it was challenging, but at the same time, it allowed me to bring back whatever I was taught in first year, like the foundation of nursing, and I was able to use the basic skills in Malawi and provide the best care possible to my patients.
Spending time with the same people for 7 weeks, getting to know them on a level like outside of nursing. Going away on the weekend was a good thing. I also taught you how to be independent. Oftentimes you find yourself alone in the hospital setting in Malawi because there's so many things going on. So my independence grew, my confidence grew, and just have a new perspective on life.
Seeing my family, going through so many different things while they're being hospitalized made me open my eyes to wanting to help.
If someone is at their most vulnerable point, I want to be that person who can come up and help that person out. What I like the most about the nursing program at Vanier is the bonds that you create with your teachers.
It's very important for us to basically be as educated as humanly possible. You learn something new every day on the job. It's not a joke. And the more education you have to back you up, the better.
Some of the classes that I'm taking now, it's everything that I've learned at Vanier, I'm able to apply and really further my studies.
I participated in the International Shanghai Nursing Skills Competition this year, and I was along with one of my classmates, and we won the first place in the competition. It's really an incredible experience, and just boosted my self-confidence and my independence, and just made me grow as a future nurse.
I think going from first year to second year is the hardest transition. I came to Vanier directly from high school. That was already hard, but first to second year is really huge. You get thrown into med-surg, you get thrown into pediatrics and obstetrics, and you don't always know what to expect, but oddly enough, you really feel empowered. You feel like a real nurse for the first time. I think I know for me this semester I had my epiphany moment, this is really for me. I was working in obstetrics with one of my clinical teachers, and just the fact that I was able to empower a patient, to help the patient, and to make the patient realize that, this is why you're staying today, this is why you're not going home today for this and this reason, and she understood and she was grateful. I literally cried. That was the most amazing experience ever, and I know I'm at the right place, and I'm very happy to have found that out here in second year now.